GSDC is accredited by the Accreditation Board for International Certification Bodies, ABICB. For 10 years, we've certified more than 100,000 professionals across Europe, North America, Asia, and Africa, with our offices in Switzerland, the United States, and Singapore. Our programs are recognized by leading publications and podcasts, including Forbes, Tech Target, People Managing People. We offer 100+ globally accredited certifications across emerging and in-demand domains like generative AI and emerging technologies, HR development, project management and agile Scrum, ISO and quality management, information security. Each GSDC certification is designed to empower professionals with confidence and help organizations stay competitive in a fast-changing landscape. Every certification is crafted with insights from 100+ global advisory board members representing top universities and leading industry experts. Our certified professionals are trusted by 500+ multinational companies, which help unlock better roles, faster promotion, and cutting-edge expertise. We partner with 100+ authorized training partners and 50+ universities, supporting talent across all career levels, from entry-level to executive leadership. As a GSDC member, you gain lifelong access to interactive webinars, hands-on workshops, SME panels, and global summits. Join a vibrant community of 25,000+ members and be part of our global events. Check our reviews on Trustpilot. We're trusted worldwide for quality, support, and impact. Whether you're aiming higher or building tomorrow's talent, GSDC is your partner in purposeful growth and impactful leadership. Visit our website to explore our offerings. GSDC, share the best practices and learn from the best practices. Welcome to the Global Skill Development Council, your gateway to digital transformation. We are an independent, vendor-neutral ISO IEC 1024 accredited certification body committed to helping individuals and organizations stay future-ready in a rapidly evolving world. GSDC, the Accreditation Board for International Certification Bodies, ABICB. For 10 years, we've certified more than 100,000 professionals across Europe, North America, Asia, and Africa, with our offices in Switzerland, the United States, and Singapore. Our programs are recognized by leading publications and podcasts, including Forbes, Tech Target, People Managing People. We offer 100+ globally accredited certifications across emerging and in-demand domains like generative AI and emerging technologies, HR and learning and development, project management and agile Scrum, ISO and quality management, information security. Each GSDC certification is designed to empower professionals with confidence and help organizations stay competitive in a fast-changing landscape. Every certification is crafted with insights from 100+ global advisory board members representing top universities and leading industry experts. Our certified professionals are trusted by 500+ multinational companies, which help unlock better roles, faster promotions, and delivering cutting-edge expertise. We partner with 100+ authorized training partners and 50+ universities, supporting talent across all career levels, from entry-level to executive leadership. As a GSDC member, you gain lifelong access to interactive webinars, hands-on workshops, SME panels, and global summits. Join a vibrant community of 25,000+ members and be part of our global events. Check our reviews on Trustpilot. We're trusted worldwide for quality, support, and impact. Whether you're aiming higher or building tomorrow's talent, GSDC is your partner in purposeful growth and impactful leadership. Visit our website to explore our offerings. GSDC, share the best practices and learn from the best practices. Welcome to the Global Skill Development Council, your gateway to digital transformation. We are an independent, vendor-neutral ISO IEC 1024 accredited certification body committed to helping individuals and organizations stay future-ready in a rapidly evolving world. GSDC is accredited by the Accreditation Board for International Certification Bodies, ABICB. For 10 years, we've certified more than 100,000 professionals across Europe, North America, Asia, and Africa, with our offices in Switzerland, the United States, and Singapore. Our programs are recognized by leading publications and podcasts, including Forbes, Tech Target, People Managing People. We offer 100+ globally accredited certifications across emerging and in-demand domains like generative AI and emerging technologies, HR and learning and development, project management and agile Scrum, ISO and quality management, information security. Each GSDC certification is designed to empower professionals with confidence and help organizations stay competitive in a fast-changing landscape. Every certification is crafted with insights from 100+ global advisory board members representing top universities and leading industry experts. Our certified professionals are trusted by 500+ multinational companies, which help unlock better roles, faster promotions, and delivering cutting-edge expertise. We partner with 100+ authorized training partners and 50+ universities, supporting talent across all career levels, from entry-level to executive leadership. As a GSDC member, you gain lifelong access to interactive webinars, hands-on workshops, SME panels, and global summits. Join a vibrant community of 25,000+ members and be part of our global events. Check our reviews on Trustpilot. We're trusted worldwide for quality, support, and impact. Whether you're aiming higher or building tomorrow's talent, GSDC is your partner in purposeful growth and impactful leadership. Visit our website to explore our offerings. GSDC, share the best practices and learn from the best practices. Welcome to the Global Skill Development Council, your gateway to digital transformation. We are an independent, vendor-neutral ISO IEC 1024 accredited certification body committed to helping individuals and organizations stay future-ready in a rapidly evolving world. GSDC is accredited by the Accreditation Board for International Certification Bodies, ABICB. For 10 years, we've certified more than 100,000 professionals across Europe, North America, Asia, and Africa, with our offices in Switzerland, the United States, and Singapore. Our programs are recognized by leading publications and podcasts, including Forbes, Tech Target, People Managing People. We offer 100+ globally accredited certifications across emerging and in-demand domains like generative AI and emerging technologies, HR and learning and development, project management and agile Scrum, ISO and quality management, information security. Each GSDC certification is designed to empower professionals with confidence and help organizations stay competitive in a fast-changing landscape. Every certification is crafted with insights from 100+ global advisory board members representing top universities and leading industry experts. Our certified professionals are trusted by 500+ multinational companies, which help unlock better roles, faster promotions, and delivering cutting-edge expertise. We partner with 100+ authorized training partners and 50+ universities, supporting talent across all career levels, from entry-level to executive leadership. As a GSDC member, you gain lifelong access to interactive webinars, hands-on workshops, SME panels, and global summits. Join a vibrant community of 25,000+ members and be part of our global events. Check our reviews on Trustpilot. We're trusted worldwide for quality, support, and impact. Whether you're aiming higher or building tomorrow's talent, GSDC is your partner in purposeful growth and impactful leadership. Visit our website to explore our offerings. GSDC, share the best practices and learn from the best practices.
Hello everyone, welcome back to the Learning and Development webinar. My name is Pratibha and I'll be your moderator. So if at any point you have any question or if you want to know more about the GSDC initiative, please feel free to drop the thoughts into the chat box. We'll be keeping an eye on it. And let's make this interactive. So if you have any questions related to the session or if you want to connect with our speaker today, if you want to ask anything away, even in the if in the middle of session, otherwise at the ending of session, please don't hesitate to use the chat box. Also you can do the thumbs up or you can do the hands up when you have to ask anything while the session, and then you can ask your question in the chat box and we'll be keeping an eye on it. Speaker will be engaging and participating according to that. So let's start with the event. Just allow me a minute to share my screen. Meanwhile, please do let us know from where you guys are watching and what do you think about the webinar we are scheduling for you. How you guys are taking this applied learning journey into your professional life. We would love to hear your feedbacks. Just allow me a minute, please. So, on behalf of the Global Skill Development Council, I'm truly delighted to welcome you all into the Learning and Practice Real World Learning and Development Case Studies Across Industries webinar. In this webinar, you will be unlocking the secrets behind industry leading learning and development transformation, real world case studies you can apply in your professional life. So one of the things which make this webinar is amazing, that's the expert of panel we have lined up for you. Some of them have already given an incredible and insightful session, and others are all set to bring in more powerful ideas. So make sure you're grabbing every session at 8:30 a.m. CST, 10:30 p.m. SGT, and 8 p.m. IST, because every other speaker have a very special session for you which you can apply in your daily professional life. So, for those who are joining with us for the first time, well, let me give you a quick introduction who we are. Global Skill Development Council is a globally recognized certification body. We are accredited by ABICB. Till yet, we have 250,000 professionals certified with us. We have 100 plus training partner associated with us. We have 500 plus subject matter experts who contribute to our program. We are associated with 1,000 plus multinational companies and 50 plus university worldwide. We are also very proud to be associated with our media partner WordPress Hub. So, and currently we are covering 100% certification portfolio in our program. So these are the training partners which are connected with us from the Asia, Canada, Africa, US, Nigeria, Australia, Singapore, and many other countries. Thank you so much to the training partners who are helping us to improving our training programs day by day. And a special thanks to our media partner WordPress Hub for all of our press releases, event releases, and to helping us and amplify our initiative and reach it to the wider global audience. So now I wanted to make a very excellent announcement that we have just launched a very unique platform called GSDC AI Studio, Lifelong Learning Initiative. In this GSDC AI Studio, you will be getting 100 plus live monthly session with global experts, which include the 4 daily sessions, 45-minute live expert lead session from hands-on learning, session from global experts. You can learn directly from our AI leaders around the world, real time practice, apply concept immediately and get your question answered, certification ready, training aligned with industry standard for job ready skills. Now, how you can get the benefit of this GSDC AI Studio? Well, let me tell you. So, there are three ways from which you can get the benefit of GSDC AI Studio. First, we have a free 30-day access in which you will be getting the 80 plus live session per month and access to full GSDC Studio. Second, we have a GSDC lifelong membership, which is from the $109, and you will be upgrading to Pro. You will be getting the lifetime access, 80 plus live session per month, access to full GSDC Studio, free GSDC membership, and access to physical events. Last but not the least, we have GSDC certification lifetime membership. So this membership is for a very limited time of offer, which is starting from $100. So make sure all of the participant you're grabbing this offer as quickly, because you will be getting the benefit of GSDC certification, all benefits of lifetime membership, personalized coaching, capstone projects plus AI tools, GSDC Copilot, and competency assessment tool as well. So as I told you that currently we are covering 100% certification in our portfolio, which covers the learning and development, HR, generative AI, agentic AI, emerging technologies, ISO lead auditor and implementer, project management and PMO, agile DevOps and SRE, cyber security, digital transformation, and many more. Now it's time to welcome to our today's speaker, Dr. Ibrahim Mansoor. So, Dr. Ibrahim Mansoor is a US trained surgical and clinical pathologist, having completed his training at Northwestern University School of Medicine and Fellowship Program at Yale School of Medicine and the Mayo Clinic, Rochester. After practicing in the United States, he returned to the Middle East to advance laboratory medicine first as director of laboratory and blood bank at the International Medical Center, and currently as a director of laboratory services at King's College Hospital, London, Jeddah. Dr. Mansoor has a deep interest in digital health strategies, health connectivity, interoperability, and AI driven pathology transformation. He has published extensively across multiple disciplines of pathology. And he is going to lead the session today on Insider Hospitals Learning Transformation, turning compliance training into clinical confidence. So you can explore how you can use the training into clinical confidence and you can apply in your daily professional life. Welcome to our platform, Dr. Ibrahim Mansoor. Thank you so much for your time, and we are very honored to have you as our speaker. The stage is all yours.
Thank you so much, Pratibha, and thank you, GSDC, for giving me this opportunity. I just wanted to make sure, Pratibha, my screen is being displayed now.
Yes, it's being
Perfect.
displayed.
Wonderful, great. So, hello everyone. I am Dr. Mansoor. I am a head of the laboratory services, and I am involved in clinical informatics in the hospital setup. So, I will be giving you, basically covering you, giving you examples of how a hospital learning transformation, and so basically, hospital, it's a very intricate and very complex place, which is highly regulated, and make sure my screen is not moving. One second. Oops, moved really fast. Okay, so I'm sorry. So hospital is actually a very complex and highly regulated environment, and that relies on very intricate processes. And uh, above the processes, usually a lot of human factor and human vigilance factor. It's one of the major uh, a complicated process. So, as if you compare to other industry, which are very they can easily be implemented and industrialized and go digital transformation. The healthcare setup it is it is one of the last sectors to actually enter digital transformation. Is one of the last sectors to actually adopt AI and other these emerging technologies. And today, so I'm going to be focusing on how you can utilize these artificial intelligence LLMs and for you and basically I my main focus is how do you implement these changes, not generic but data driven, and that data driven information can actually bring a lot of confidence into the clinical practice and fill in the gap that usually exists. And I will be covering some details on that. So my basic points that I'll be covering, I'll be talking about the hospital industry as an industry has a lot of potential for errors, and there are historical perspectives of this. Then we will talk about digital transformation and how patient safety is a very critical component of the healthcare. And we will talk about education and training interventions in healthcare. From there, I'm gonna jump into some basic case scenarios that I have implemented in my practice at King's College Hospital, London, Jeddah, and I'll be sharing some basic stuff, not very high end like RAG-based learning or things like that. A video-based learning through AI tools, personalized training, and e-supervisors, which is a personalized competency testing competency program through LLMs and AI tools. And then I will basically jump into data collections, how you can use these AI tools not generically data driven, and where you're going to drive this data. I am going to be diving into over here how you can utilize middlewares and data analytics and Power BI solutions that actually drive the data and then use them in your AI solutions to improve your competencies. So with that, I just wanted to mention that I'm one of those very interactive people. I love to hear people ask. If you have any question, please feel free to jump in and ask. It will be great if it's an interactive session. It will be very nice. So hospitals. Healthcare industry, it actually started as a shock in 1999 when the world discovered that the hospitals could be as dangerous as disease. So it was Institution of Medicine that actually released a report estimating approximately 98,000 preventable annual deaths just in the United States. And these were more than combined all car accidents and breast cancers combined together. And that was a shock. Literally, as a healthcare industry, we were not aware of this fact, and that really started a wake-up call moment for the healthcare industry. And a lot of these safety protocols, just culture, and all these activities actually started from that IOM 1990. But then later on, uh, uh, fast forward in like 2016, there was an analysis published from Johns Hopkins that they actually doubled this number significantly, and they estimated around 250,000 deaths per year from medical errors, making it the third leading cause of death just in the United States. So just imagine that if a jumbo jet full of patients crashing every day, that is the kind of scale we're talking about. So there was a significant number of errors were happening in a hospital setup, in a medical care setup. And they actually said 50% of these were actually preventable. And that's where, safety and healthcare interventions came, and they played a major role. And I will be basically jumping into how can we utilize all these tools. So if you zoom out, one in every 10 patients worldwide is harmed during the care. This is, according to WHO, patient harm ranks among the top 10 causes of death and disability globally. So literally, and the cost, the preventable errors are approximately affect 7 million patients with a cost over 20 billion US dollars, a very significant number. So basically, patient harm or a patient error is basically a climate change of healthcare. We talk about climate change. This is the climate change of healthcare. So I'm going to basically mention, there are two types of errors that happen. And in healthcare is actually a very different industry from the rest of the industries. There are errors of omission, means that everything was done correctly, but no action were taken after a certain event. So this is the errors of omission, and you will be surprised that significant number of healthcare errors are because of healthcare of the errors of omission, which is very different from the rest of the industries. The rest of the industries, the majority of the errors are errors of commission, which occurs because the results that results from an incorrect action taken. So if you look at in the healthcare, a majority, if you want to just summarize the patient safety, 70% of patient errors or patient harm is because of lack of communication. So this is something very critical that we need, and we want to see how can we utilize these tools that are available in the current age, these emerging technologies, to improve the current environment of the healthcare. So one of the major reasons why we are very different from the rest of the industry is because of our electronic systems. So EHR, electronic health system, it was since almost up to 2015 was not majorly implemented in even in bigger hospitals. A lot of hospitals were not using EHR. It was all manual paperwork based systems. United States actually started this act in 2009, which is called High Tech Act, and it is also called Meaningful Use Program, which incentivized the hospitals and incentivized the healthcare practitioners to adopt these healthcare systems and to bring them on board. And it was not until 2015 and 16 when we significant number of these healthcare practices and physicians, they start utilizing these. So we're not even 10 years old right now. in utilizing our systems. If you compare that to retail market, to banking, they're 20, 30 years into their systems. They have implemented version 1, 2, 3, 4. They've matured really fast. And despite all this growth, we significantly still are very fragmented and systems across the database. You will be surprised that the most clean and most perfect and most accurate data, which is extensively used right now for AI development and many decision making and policy making, are still billing data, because the billing data is standardized. It has all the codes. It's been structured in a very perfect manner. So still a lot of the clinical decision making, a lot of policy making, a lot of AI data analysis is still done on billing data and not the EHR data. So with that, I just want to let's meet our EHR. This is our EHR. And you can see that from the very look of it, the way it is, it's basically a collection of silos. At the heart of an EMR or EHR system or hospital information system is the patient registration process. And everything kind of spokes out from this central process, and they end up becoming a very silo systems that are not communicating with each other. And a lot of people really, they blame the systems. It is not the systems to be blamed. It is actually what is the ground reality. The people who create the systems, they look at the reality on the ground and they build systems based on that. And healthcare is one of those areas which is very like, if you are an internal medicine physician, or you are specialized in lab, or you specialized in radiology, you're so focused in your area, you have your own societies, your communication ways, you're just completely different. And there is no way of interacting and connecting these together in the system. So that's why it creates that fragmentation that exists in the healthcare system. It's just rooted right now. And now with these emerging technologies, we have a lot of these new things that are coming. So digital revolution, actually, I think, is the first real vaccine against human error. I want to mention that, this is a very powerful intervention that came, which is computerized physician order entry. It reduced medication prescription errors by 55%. So instead of all these manual entries, if you control the system, you control the system, and you automate the system, the errors drop significantly. It is like, basically, you basically, before that, uh, uh, patients, the doctors, we usually hand scribe things which has many issues in it. When you move to the computerized order entry, the orders were fixed, they were dropped down, they were normalized, in the sense that everything can be tracked from all the way from the order to all the way to the delivery. Then further, this is for the order, and then when we want to implement the medication, errors can still happen because the human vigilance factor, they controlled it by barcode medication administration system. You have to barcode the medicine and barcode the patient ID, and that's how you were able to significantly decrease the error rates by 41%, and adverse drug reaction by 50%. So basically, it's like writing, when you're writing your notes or directions on a scrap paper versus using GPS. So you're basically automating the entire system, fixing it, and that decreases the very few for wrong turns, and much fast delivery of the services. Again, there are many other things that were coming in: electronic checklist, smart pumps that were used to infuse the medicine. They were communicating with the EHR and getting information about what is the dosage and everything. And these communications decreased a significant number of errors. And then we had a lot of decision support systems coming into the healthcare, which is actually making things easier. So in the clinical practice, a lot of these this decision support tool layer were added, especially in diagnostic area. I'm coming from the diagnostic area. In the diagnostic area, it significantly improved our performance by adding this layer of AI. So AI was able to scan the radiology reads beforehand, and it was able to triage highlight the important images. These are first to be reviewed, and they will basically highlight, and it will make the pathologist or the radiologist, similarly with the pathologist as well. The slides were reviewed ahead of time. They were screened, they were triaged, they were marked that this is a critical area. Somebody has to review them, and that helped to reduce the diagnostic errors by 30%. And we have now a lot of new predictive tools coming into the EHR that can actually alert the patient deterioration of the condition by indicating that there is a possibly sepsis coming in, or other prompts that will alerts that will actually indicate the physician that this patient needs an attention. So these tools in the clinical area really helped a lot. So I'm going to just focus on a very basic implementation of these tools. And my main area of coverage today will be competencies. I will be covering mostly allied health. I'm coming from labs, so mostly I'm going to be talking about technologists, technicians, and nurses, training and competencies. So I want to talk about the currently, there is a lot of excitement in healthcare with these generative AI tools coming in, LLMs coming in, and it's so easy to create contents now. People are really excited to create contents. But what is happening is this mass production of these generic contents, which is actually causing a fatigue, alert fatigue, and people are getting bored, and they are really not. It's not really helping the situation. It's just going back to the same thing as before. My approach is, the rare approach I think is a very personalized, data-driven systems in which you basically are understanding your process, understanding your staff and sectional need and your timely need of that particular moment of time. And then based on the data, again, I'm going to stress on this personalized training, personalized contents, personalized situation-based competencies that will evolve you into a more mature stage, and you are able to check and move forward in that. So I'm going to take you through what I have implemented in my lab, and we'll give you more examples of how things are moving. So to give it to make you understand, these are the 3 Ds of a healthcare digital transformation. So first, you digitize. Basically, you move from paper to electronic systems. But and that is a significant improvement. It decreases 87% errors. And in a very data heavy setup like lab produces approximately 70% of the EMR and clinical decision support, and 90% of the structured normalized data in an EHR. So it's a very data heavy area. If you move to automated lab, it really helps you a lot. It really decreases the number of, but it is still not the solution. Then you have to digitalize it. Means every movement of information that is happening in your system, it has to be connected through through like links in the instruments, through middlewares, through clouds, and that's where the digitalized ecosystem where data flows, but you still do not have a deep context of a deep and meaningful understanding of this data flow. So that's where intelligent connections or intelligent labs or intelligent or digital transformation comes in. So basically, this is like using a digitalized lab is like using GPS for driving, versus an intelligent lab or digitally transformed lab is like self-driving car. So it is every connection, every movement of flow of data that is happening in your system is mapped. You know everything. You have all the data coming in from the middlewares, from the EHR, and I will take you through it. And I'll take you through it, and I'll make you understand how you need to understand your data flow, how your data is generated, where does it move, even through the pipelines from the bandwidths of every single system. Where does it sit? What messaging system it uses? What information is being transferred? You have to understand everything and then derive a meaningful use from it. And then that's where intelligent digital transformation will happen. And you'll be surprised that, a hospital generates over 50 petabytes of data every year. And the unfortunate thing is that 97% of this data goes unused. And petabyte is 1 million gigabyte. That's a lot of data. So just That includes, clinical notes, lab reports, imaging equipment, logbooks, compliance data. A lot of things are there. But imagine if this data didn't just sit in the servers, but you were able to kind of utilize it in a meaningful way, and it taught us how to train us better, how to be a better clinician or a worker, on how to prevent errors. That is the game changer. That is actually what we need. We need to understand how to derive the data from the system and then use these digital transformation tools and emerging technologies to learn from them. So I'm going to briefly, and my topic is not about training interventions, but I'm going to briefly mention that these are new training interventions that are coming in that have a major effect. Simulation-based training, the aviation industry, when they realized they realized the problem, they really used simulation and team-based learning. Individualized training versus the entire team engaged in the training has a lot of impact. Simulation and team-based training really decreases the errors by 20 to 30%, because it really engages people to communicate, and they figure out these soft points or the points where it could be a gray area, and then they communicate. What about this? What about that? And that it really solves the issue and clarifies things, and people work on these to improve. And over 80% of the team-based training programs, they improve communication and safety culture in an organization, especially in the healthcare. So in the lab environment as well, we have I'm going to be giving some examples of the lab because I'm coming from a lab background. We have different types of errors in the lab. We have pre-analytical errors. Pre-analytical errors occurs when before the specimen reaches the lab into the analytical area. It comes from the order entry. It moves to the patient. Somebody draws the blood moves all the way across multiple systems, and then it ends up into the lab. That area is called pre-analytical area. 70% of the errors, 70% of the errors in the laboratory are because of the pre-analytical factors. And that requires a lot of training, a lot of training. Training to the nurses, training to the phlebotomy team, training to the IV team who collect blood from part of the hospital, different hospitals, logistics teams who are transporting these specimens and everything. A lot of training is required, and we need to understand this data before we can train them on the actual data. Now, if you look at it, the analytical portion of the lab is completely automated. It's completely fully autopilot, like nothing. We just put in, the machine does everything. And that's why least numbers of errors happening in this area, because they're completely automated. And the post-analytical errors, when the results have been created, but these results have to reach to the right set of people, the doctors, patients, and clinic teams and everything. That's where another big set of errors happen. Approximately 20 to 40% of the errors happen in this area, because I mentioned in the start, it's the results, it's the errors of omission. Means the things were performed correctly, the results were created, but the right set of people were not informed to take action on them, and that caused the patient harm, which is very different from the other industries. We are very different in that sense from the other industry, because we have to even take care of the communication after the product has been generated or the results have been generated to the right set of people, and get feedback from them that they understand and they know that what actions needs to be taken. So with this, I'm going to move into I'm going to basically start with how we implemented video-based training programs in our hospital, in my lab, and in my nursing training program. And they say seeing is retaining, and that's literally true, because it really has an impact. And there are multiple studies that actually have shown that the video-based learning, it has more control. It has more control for the people can watch when they're needed. They not just have to sit and span their attention over the hour. They can watch for half an hour, take a break, and so it really improves the retention time. And it has shown that it increases the training videos has improved the staff knowledge and retention by 30%, which I really can tell you that I have seen that in action in my hospital. And but how to create these videos? We are a very regulated environment. Any content that you are producing in your hospital, it has to be regulated, it has to be controlled, it has to be. And I'm going to show you how I do these training sessions, control these training sessions through in my hospital. So Understanding that we need to understand that we have a centralized policy control workflow for video generation, content generation. All the training material flows through defined institutional policy, outlining all the step, tools, and approval processes. Each project begins with the content control form. We have the topic, who are the responsible authors, who are the reviewers, and every video is version controlled, basically like a policy. I treat every video content like a policy, and you have to control every aspect of it. And that's how I'm telling you why, because this is healthcare. And you need to make sure that every module meets the visual educational accuracy standards and is conveying the right message. Need to understand who's the audience, and it really conveys the message. We try to do these because video production of video contents is a very lengthy process, and medicine is a very evolving field. Things change very fast, interventions change, processes change. In the hospitals, things evolve all the time. So what I have done is I have implemented very modular content creation process. We start with the introduction, specimen handling, infection control, and processes or machine related production, and then clinical interventions at the end. So we have defined processes in the video contents, and everybody it's divided into different expertise by different people, and they will work on their subject matter experts will work on their portion of the template. Everything has been is structured, so it's not like everybody's just using their own video. They're doing the same structure, same voice module, same prompts, same everything. And at the end of it, we even each modular component has been version controlled. So if we have 4 modules are being generated, the phlebotomy team creates the collection of the sample. Processing is done by different the vendors. They could play part in the machine integration, and then a pathologist will do the clinical interpretation. So 4 different modules are created and they merged together. If any portion changes, I don't have to create the entire video again. I'm just gonna change that one module. Like if the collection changes, then the phlebotomy team will change the collection portion of the video, and they will update to version 2, and then we merge all the videos and we will move to updated version of the video. Again, just to show you that it's a we are a healthcare environment, regulated. I need to control every single thing. I don't want these things to be moving around in my hospital and creating confusion. So you need to understand that the policy, everything is policy guided. The training material flow of the material, everything is controlled. We do modular creation, and then there is a quality control at the end of each video production. Again, as I mentioned, there is a from the content creation, the script, narration, and production. Every content, every portion of the video creation is quality controlled and documented. So, as I mentioned, each version, each component of the video is version controlled, and then at the end we will merge the videos and we'll create a final version of the video that will be the final the training material. We use a lot of AI tools, definitely a lot of AI tools, and I control them a lot. Like if I'm using certain prompts in ChatGPT, I have the prompts written in my policies. You need to understand that language, accent, a lot of things have a major impact on your prompting. So if you want to control something, you need to control every aspect of it. So every prompts that are needed in certain aspects are integrated into your policy. So we use ChatGPT for outlining the scripts and quizzes and MCQs and training out plans. We use video editing tools to use the editing of the videos, annotations, and synchronizing the voiceovers. We use Pictory and Synthesia for creating certain short videos. 11 Labs and DeepL for voiceover and language adoption. For these are the different kind of tools we use in different aspects of the. Again, at the end is the final product is merging all the components of the videos together, and is verified through quality control and make sure somebody signs off that they have reviewed the policy, they have reviewed the video, and it is the final version of the video. Again, I mentioned that I literally ID every single modular component of a video with a version number, so I have record of every single thing, because we are a very regulated industry. If something to happen, I have full record of what was the training given last year versus what is the difference of the training this year, and all the documents and feedback is provided to the end users. Again, this is a summary of the entire process that I just mentioned. It is a very controlled and collaborative intelligent video training ecosystem. It is modular, it is AI supported, and it is very compliant to the healthcare system. I'm an accredited lab, multiple accreditations. If somebody is to show up to my lab, I have the entire documentation process to show it to you and convince you that we have full control of the training process. This is just to give you the entire process from content creation to script and translation to final video creation into the, okay. This is just to show you we have a policy, we have a full policy that actually talks about this. It covers AI content generation, it covers the video creation, modular editing, consistent branding, AI assisted visuals. It covers the audios and the translation if ever needed, the prompts if ever needed, and it talks about the quality controls and version management of each video content that we produce. I'm going to just briefly show you small clips of some of the videos. They're generic. They are not, this is one of the introduction ones. Briefly play them, and then I will move forward to the next.
Ibrahim, just wanted to check if there is any sound in this video, so we are not able to hear it.
Oh, you're not able to hear it. Okay, I'm sorry then. So I'm
Yes.
just going to skip it because I just showed there is a sound in there, but let's just skip it. So this is the next video. This is a point of care nursing training program. There is a sound in the background, very engaging. It really talks to the nurses and engages them in a certain manner to point out this is very important. This is the routine process. This is the procedures and everything like that. So these are just of the examples of the videos that we have. So let's move to the next chapter. So the next chapter is using basically a personalized learning AI supervisor kind of tools for individualized and personalized skills. So there is some literature on it. I haven't find anything published in medicine that actually talks about competency through LLMs or ChatGPTs or anything like that that can act as a staff training as a supervisor, an e-supervisor that actually monitors the each component of training that is required for that particular individual and that particular section and that particular nurse or that particular floor. So I'm going to show you how I have created a very personalized training program for my staff, for my nurses in certain areas. And we use ChatGPT. And again, it's a very controlled process. I need to, if I'm implementing this, I need to make sure that every process is controlled, everything is moving in the right direction, and nothing mistakes happen. Um, uh, so basically, we take a staff or a section or a profile or an environment where that we do that particular training has to be created. We train the model. We use ChatGPT, basically upload policies and documents that are relevant for that area, and then we basically create a Microsoft form, competency forms. These competency forms are used to evaluate the staff. It can be done online, usually done in the live environment because some of that requires the performing certain tasks and everything like that. So they're filled in the Microsoft form, and then they're given to the ChatGPT, and then we use ChatGPT to analyze. So I'm going to take you each step at a time to give you an understanding of how things are moving. So you basically create a dedicated project for each. So this is usually done by my seniors or supervisors that are possible for each section. They're responsible for certain section of staff. They're responsible because we are very niche and very specialized area of hospital. So what we do is we actually train the supervisors. Again, everything is policy controlled. The prompts are policy controlled, and everything has been written and documented so that we have full control of that. So we created a dedicated project for each staff, which is basically a digital folder for each staff. You create a project. You staff pers we try to hide the names. We don't use the names. We use IDs or something like that so that privacy is maintained. Each project is basically each file is basically project is a digital file for each staff. That basically we're using each project using the staff ID, and then we put a description of that purpose of that is like if it's a microbiology or a nursing or point of care. We can personalize it by descriptions, by coloring certain images and colors. Like I have microbiology has one color, and we give them a special. So make it easier if you're handling 10 staff, it's much easier for you to understand which section is handling which portion of it. This is how it actually shows up. You create for your team, entire team. You have a project has been created in ChatGPT for each member of your laboratory team. Now, for each individual, even within the one section, each individual is not performing the entire task. They're dedicated to certain benches or certain tasks. They're not performing some of the tasks. So, if they're not performing some of the tasks, I don't want them to be trained on that area. The generic training is done, but I want them to be very specific in the areas that they are working on to be mastered on that area. So we add supporting documents into ChatGPT, texts about that particular person to have full understanding. We add policies, SOPs relevant to that area. Again, you make sure that you keep the privacy, don't add personal information or information that is something that you don't want to disclose to anybody. These are information for that particular area. Basically, we're giving context of that person training to that project. And then from there, we add individual documents for that person training, that this person has been trained on this. He has already performed certain experiences in this area. What is the qualification of this person? How much experience this person has? So we basically personalize that folder for that particular individual, and providing that these trainings have already been performed for this person, per particular individual. And then we upload our is policies. We have our policies that are basically have a structure of our organization policies of competencies, because I don't want ChatGPT to be describing how he's going to run the competencies. I have my own competency policies. I have my policies that requires that a certain orientation has to be performed at this time, then after 3 months, and after 6 months, or I have a structure for that. So basically, ChatGPT analyzes the organizational policies of our competencies and procedures, and certain forms and timelines that is needed to build a clear picture of the competency process and the timeline for that particular individual, for that particular individual training. So just to give you an example, uh, then we basically ask ChatGPT uh, to learn the competency frameworks from the policy procedures and make the foundation of the solid foundation for the competency assessment for the particular staff. Again, you see the timelines right here. Every staff is required to have a initial competency, then every 3 months, then every 6 months, then annual. So all this has been established into that project. Then we start uploading individualized policies sorry, competencies for that particular individual of that particular project. And the ChatGPT will evaluate these competencies and will give us areas of weaknesses or areas of improvement, and things that can be done. And this is just an example of ChatGPT provided us a feedback indicating whether the staff has passed the initial competency. And this is, in this case, the person actually passed the initial competency. All the areas that were tested was done, and it was very objective and is traceable. That all the areas were trained. The person is trained on these areas and has successfully completed that. After 6 months, you upload the semi-annual. Again, these semi-annual competencies can be created by ChatGPT through already this kind of information. We usually create MS forms, Microsoft forms, and usually done. We upload the forms and do a reevaluation of the competencies to see if there's any gap or any regression in the training cycle, or any further steps needs to be done. And again, we looked at this step and we found this individual. This is actually a case. The ChatGPT actually provided a full evaluation highlighting the gaps. We found that this person has certain weaknesses in this one area, Then we asked basically the ChatGPT to create the corrective action plan. Again, instead of generating a generalized corrective action plan, we update our format. They say we need action in our format, in our timeline. Like we want this is our internal form that we use, that it has what kind of corrective actions needed and how to be implemented and everything like that. So we're not creating generic corrective action plans. We're actually forcing our documents to implement those organizational framework to be implemented in the training program. And this is how actually shows up. The assessment was performed, and there were 4 areas of failure. And based on these 4 areas of failure, you have the action plans for each senior and the actions that are needed for the corrective action plans. And this is how we actually did the reassessment, uploaded the reassessment, and the person successfully completed its competency. We can actually not only use this, but we can actually use the smart calendar in the chat GPT. So it will actually, if it will use the track of the due dates, for this particular individual, you don't have to remember it. Instead of creating this, act like a smart calendar. It will remind you for upcoming reassessments. It will in the chat GPT has all the calendar tools. It will automatically remember that and will keep you track and update you. We're talking about, each supervisor have 6, 7, 8 staff, so it really makes them very easy. They understand everything instead of going to their excels and everything like that. It has a full control of their competency and understanding of what is happening and what is needed. One of the most powerful thing that I found is that you can use your incident reports. Every hospital has these incident reports, that a hospital that is very using a just culture environment, it is highly recommended that you any anything, any findings, even near misses, doesn't have to be a mistake. Any near misses, you can actually report that into a system anonymously. They will not blame shame you. They will pick it up, and you can actually analyze and integrate that into your system. So I actually use these incident reports and actually derive information from these incident reports, and I add them into the sectional training section. Like if I'm having a lot of problem in microbiology, say microbiology, I'm having a problem in microbiology. A lot of specimen rejections are happening, or contaminations are happening, or things are not going correctly. I will integrate that into their competency forms, that I'm having a problem overall in this section. So everybody going through microbiology interventions will have an extra training in their competency assessments. So now again, this is very basic. This is very basic. Uh, we are building some advanced tools. Like in blood bank, we're using rack-based automated systems that will automatically analyze the immunophenotyping, and will alert the patient or alert the technician that this is not the correct type of typing, or this is not. But these are very advanced. It requires coding skills and everything like that. But the one I've presented, it doesn't require anything. Anybody can do it. It's very simple. But you need to understand that everything has to be controlled. You are in a regulated healthcare environment. I treat every single prompt on a ChatGPT as a policy. I need to control every single aspect of the process as a fully controlled process, and then all I can have full confidence that I'm actually running a personalized training program. So with that, I'm gonna switch my directions a little bit, and I'm gonna jump into what are the areas of data deriving that can really help derive data from the our hospital systems. So as we talked about, the EHR is a very modular system, but patient does not enter in the EHR straight. There's a lot of these other systems that are they're sitting, they are that communicate with the EHR. So we have can have lab information system. There's a billing system, queuing system, and all of them have a middleware. And I really believe that a wealth of information exists in these processes. That's where, if you want to improve your process, you need to grab the data from these middlewares. Otherwise, you're not going anywhere, because that's where the wealth of the data is sitting. So I am very strong proponent of utilizing the middlewares in your hospital. And in the lab, I use them a lot. I have trained all my staff on that. We derive every single piece of information from the middleware, and we learn from it how our data is flowing, where are the bottlenecks, where are the problems, where are things moving. And that really helps. So the middlewares are basically a backbone of an intelligent automation system. And they're not just data transfer tool. They are intelligent, they're customizable, and they are solution. And they're one of the best thing is that they are highly specialized and they are developed by domain experts. So if you have a telemetry or if you have a vital signs system, they're made, these middlewares are made by the experts of that systems. So they really know how to catch every single piece of information on that. So I really believe middleware is the key to unlocking efficiency and flexibility and data-driven intelligent automation. I'm really push for it, and I know a lot of people. It is difficult. It's not easy. You need to help from IT and understand. Uh, the good thing about middleware, see, when we use the EHR, the physicians, they order the test and then they see the results. But there's a lot of things happening in between, and that's where you need improvement. That's where you need to train your staff and improve the process. So middleware actually gives you the entire flow of the data, every single dot points that are of the patient journey. It provides you these extra dots that you can actually connect them together and learn from them. So you have specialized areas like in the lab. We have specialized areas. We have serum workflow, molecular workflow, coag lab, hematology, urine analysis, microbiology, and the specimen comes in the lab. It moves into the specialized areas and it goes into these specialized sections, and a lot of process has been done on them. We need to understand and go into these areas and derive data and understand what is your workflow, what is the movement of the specimen, how is it moving, and where I can work to improve the system. This is just to show you a dashboard. The middleware dashboards, because they're made by experts. So this is my primary middleware dashboard. This is the top layer. This is the topmost layer, and it displays really a real-time overview of the entire activity of this activity. Like I usually display them in my core lab, right in the middle into the screen, so everybody can come and see and say why this is red. It shows you time indicators, color coded, turnaround time status, critical flags, pending tests, like a lot of pieces of information in one piece. A very visually designed, user friendly, with a lot of information, a lot of information. That's the power of the middlewares and the dashboards, because they can really provide you a lot of detailed information. And this is the top layer. You know, you can drill down on each one of them. If you click on this red one, you can go deep into it and further explore what are the actionable items you can do and learn from it. So this is just to show you, you can learn on that. You can click on one of them, and you can go into the deeper action and understand the deeper perspectives of each scenario or each patient that is happening. Again, this is I really ask people to really look into, explore into the middlewares that you're utilizing and see how you can derive data from it to actually train the competency and personalize the competency for your training and improve the processes. The other area is data analytics. Data analytics are very powerful, intelligent. I'm of a belief that data-driven decisions, they really make a lot of impact. And I will show you examples of live examples that we have implemented through data analytic tools. Basically, write data at the right place. Basically, write data at the right place or in the right meeting at the right set of people will make the impact. So I will show you some examples of how we use data analytics into utilizing and improving our laboratory workflows. This is just to show you we have an automated BI, business intelligence based of data analytics tool that sits on top of our middlewares, and it derives a lot of pieces of information. You just like in any BI tools, you can actually create automated reports from each set of parameters that you want. You just send them that I mean ER lab turnaround times to be sent every morning 8 o'clock to these people, the emails. So you can create automated future reports, and we'll automatically go through that particular set of data, create the report, and at 7 a.m. when they go into the huddle meeting, all the data will be in front of these people ahead of time. You can actually look at workload analysis, instrument utilization, turnaround time, a lot of pieces of information that sits in the middleware. You can analyze them intelligently and really make a lot of sense out of them. This is just to show you we have multiple sites. You can compare a set of time, like you're comparing 2 months and seeing what is the difference between this month versus that month. What is the flow like? What is the changes? And each piece of information actually gives you a lot of wealth of information that you can understand from it and make changes into your system. Uh, you can have the data of the volumes by days of the week, by hours of the day for each site. Like we have multiple sites, we have multiple hospitals or multiple labs. You can have each site. You can have the comparison. You can look at what are the peak hours from this BI tool. You can analyze that. You can look at individual lab and look at their turnaround time, for example, turnaround time, and see how many outliers are there. And these outliers, they're not that many, but these outliers are a wealth of information that really it's a load of information is just hit. I consider them a literally a if you dig into these outliers, you will find process control problems, supply chain problems, staffing problems, many issues. This is where automatically you don't have to wait for any harm to happen. These information is right in front of your hands, it's right there. Instead of letting them affect the patient care, you proactively look into these outliers, analyze, find a team of people who will look into this, and you will find stories of it, and each one of them as an improvement project. So again, you can look at every different and see if there's any turnaround times, any outliers, and you can improve them. You can actually do them on individual tests. Like you could take a particular test, like certain tests like troponin is very important for us because it's a cardiac marker, and it can have a major impact on the patient harm if any delays happen. So we take serum potassium and serum troponin, and we really take it very seriously and see any delay in this test is a warning sign. I'm gonna literally look into every single aspect of that process and understand why this delay is happening. So you understand how these tools are very powerful, and they really give us a lot of data to train our staff and improve our processes. One of the things that I really like about take these outliers and you distribute them in the hours of the days and the hours of the day and the days of the week, you can actually see a pattern. You can see that in this case, we had seen that it is at this around this time then when the shift is changing. And that's we realize a lot of the outliers were lining at this, and we actually realized this, and we actually implemented processes that instead of making shifts like this, we have an overlapping shifts. So there's an hour or two of overlap so that the handovers can happen in a perfect manner, so that these delays do not happen because of that. So you can take a very meaningful action from this data. And I'm coming to the end of my session, and I'm going to give you a real story. So this is my ER lab. I had an ER stat lab that was actually performing. Uh, this is the number of tests. This the yellow line is the number of tests that this lab was performing, and the green line is the number of outliers this lab had. So we implemented our BI tool. So every morning when the ER lab staff, and not only the ER lab staff, but the ER physicians were every morning 7 a.m., their turnaround time report was sent to them through the BI tool, Power BI tool, to the entire team. And every 7:30 a.m. they get together and they discuss why this specimen was delayed, why this was delayed, why this was delayed. So everything was right in front of them. Now I'm telling you, I did not change anything. I did not increase FTEs. I did not hire any people. I did not change any machines. I didn't do anything. Just the implementation of this BI tool and implementing the huddle and discussion every morning completely changed the way things were moving. The volumes, literally over the period of 7, 8 months, the volumes tripled and the outliers gone. So I'm telling you, you need to understand the power of data. And this is a live example of that, is that my volumes tripled, no FTE added, no other person was hired, no extra system was involved, no extra machine was hired. The outliers is zero versus they are almost very high here. The outliers are zero, and the numbers of tests have tripled. This is the power of the data. This is the power of data, and this is how you understand and implement the process changes that is happening. And it's not only for the lab. You can look at many other industries. This is a very big hospital, a 700-bed hospital. I'm de-identified the hospital. I'm not mentioning the name of the hospital, but measuring and uh, monitoring and feedbacking a call center of a very large hospital. You look at before and once you implemented the measurements and the feedback, constant feedback. Every morning, the call center staff knew exactly how many missed calls, how many details. No FDA changed. 80% reduction in the abandoned calls. This just powerful. So again, data is very powerful. You just really have to understand and implement in the right manner, in the right way. That really helps to improve the process. Again, this is my last concluding slide. Hospitals error remain a global challenge, and it is uh, but digital tools, training modules, personalized e-supervisors, and a lot of these AI tools can really improve these regulated, very sensitive life and death situations. It really can help. Continuous improvement requires synergy between people and technology and safety culture. Invest in personalized and engaging training and robust safety systems. The most important point that I really want to stress on you is leverage the data to monitor, learn, and adopt the care process. It shouldn't be the same old process. Adopt and change. And this is the ending quote. And with that, I have one story to share with you as well. Every hospital has a data to heal itself, if only it learns to listen from it. So, the one of the last story that I want to share with you, there's a hospital. They actually launched a small project through in which they just basically start recording a small video of every incident, major incident review, and turning them into like a 2 minute training clip for the staff and sharing them onto the staff. Very simple process of every incident report. They actually created an intelligent video out of it, and they shared it with the staff. And I'm telling you, this basic implementation, within 6 months, their error rates dropped by 40%. And again, they didn't buy anything new. They didn't use any very high-end AI tools. A basic learning technique can actually have a major impact in on your hospital system. So with that, I really want to thank my amazing team who really work with me and have the right mindset. I'm one of those people that when I interview people for hiring, I want to make sure that they know some basic computer skills. They know Excel very well. And one of the easiest way to introduce them to LLM is that when I finish the interview, I ask them, can you send me the summary of my interview back to me? So that gives me a brief understanding of what is their LLM understanding, how strong are they in their understanding of the usage of the LLMs. And if I found them weak, I ask them to attend some courses or I provide them some information. It is one of my basic requirement of my training as a hospital staff that they need to be good in certain computer skills. Otherwise, we're not going to be able to implement and bring a technology that or a high-end care system that we are planning for. So again, I want to thank for your attention. Together, we can transform the hospital learning and save lives. AI tools and transformation, these digital transformation tools are very powerful if used in a in a careful manner with a controlled environment, with the right set of people, can have a major impact. Thank you so much. And that with that, Pratibha, you can take over.
Thank you so much, Dr. Ibrahim, for this amazing and insightful sessions. I'm sure our participants have learned a lot. So the floor is officially open for question and answer. If you have any question, please feel free to drop them in the chat box. And so the first question we have from Olu, that he's saying that I missed the point about middleware. Do you mean that the information generated from GPT can be fed into middleware for further uses?
So that's a very nice question. So I'm gonna mention that no, it's the other way. So I actually create the data from the middleware. Because the middleware is the where the data flow of happening for the process. So the process of the hospital is the detailed process of the hospitals, the very fine details of the process of the hospitals is hidden in the middleware. So I extract the data from the middleware and I feed it into the GPT to learn patterns from it and create training sessions based on that. So we learn from middleware data what are the areas of improvement that are needed, and we focus and ask ChatGPT or our e-supervisor to focus on that areas of training so that we can improve those areas of lag or the areas that are missing. Hopefully that answers. So middleware basically is a data generating tool that can be used to personalize the training for your hospital, for your section, or for your staff.
Thank you so much, Dr. Ibrahim, for those detailed and thoughtful answer. I'm sure our participant has gotten the clarity. So, if you have any other question, if you want to ask any other question, please feel free to drop them in the chat box because we are running out of the time. So, we'll try to cover as many as the question we can. Just please use the chat box. Meanwhile, Dr. Ibrahim, would you like to give any final statement, please?
Yeah, so I would really like to say that, in a healthcare setting, we tend to be one of those people where we're not tech savvy. We don't like information technology a lot. But I think this emerging technologies and AI is changing everything, and we really have to kind of understand the infrastructure of the data flow in our sections and in our hospitals, and have a better understanding of your process through this. So this is my final say, that please get involved, learn your processes through through your EHRs, through your systems, through your middlewares, and have a stronger understanding of your process so you can actually deliver better care for the patients.
Thank you so much, Dr. Ibrahim, for those amazing statement. So I'm sure our participants have been a roller coaster ride on learning journey today, and they have gotten the strong insight from your session. So now, as I am sure, like the participant wants to connect with you for many questions, but might be possible they are not able to think anything right now. So what I'm doing, participant, I'm sharing Dr. Ibrahim's LinkedIn ID in the chat for your convenience so that you guys can connect with him. And if you have any question or if you want to ask any guidance, I'm sure Dr. Ibrahim will be happy to help you out. Right, Dr. Ibrahim?
Yes, of course, anytime. Please reach out to me if you have anything specific that you want to. I would love to help you, and feel free to reach out to me anytime.
Thank you so much for that. So, thank you so much once again for your amazing and insightful session. And now, as I told you that as the time we are running out of the time, so it's time to move ahead. So I just wanted to make few announcement before wrapping up this session. So if you guys think that you guys are ready to take the certification for the learning and development, and if you want to graph for it, you can go into our website and you can get the certification from over there. And for our participant, we have a complimentary coupon code which will give you a 20% off for the certification. So make sure you're grabbing this offer because this is for a very, very limited time of period and this is for only our participant as well. And so I have an announcement regarding one more tool which we have launched that called utility tool. So utility tool will help you to make your job hunting journey very easier and stand out your profile in front of the recruiters and HR. So in today's AI world, everything is working onto the AI seminar and everything, right? So the recruiters and HRs also help take the help from the AI to use screen your profile. So that will make your life easier by the utility tool. What you can do, you can log in into the utility tool by using the LinkedIn ID and password. And that tool will access your complete LinkedIn information and give you a recommendation according to the job industry and the profile you're looking regarding your bio, profile, designation, and everything. So please make sure you're grabbing this opportunity because without AI, getting a job a little bit difficult, but with utility tool, it will make your life easier and it will make you stand out in front of the recruiters and HR for your job hunting journey. Also, for our participant, we have a complimentary code which will give you 100% off for using this tool. I'm sharing the coupon code in the chat box for your convenience, guys, so that you can grab this opportunity. And before wrapping up, I just wanted to make an announcement regarding our others events. So we are conducting other event as well, which include the ISO 42001, ISO 27001 across industries. And this webinar is going to be from 3rd November to 21st November at 8:30 a.m. CST, 10:30 p.m. SGT, and 8 p.m. IST. We have another webinar, AI and delivery, solving real project management challenges with generative AI. This is going to be conducted from 10th November to 14th November at 6:30 a.m. CST, 8:30 p.m. SGT, and 6 p.m. IST. And I am going to host one more webinar after this, which is GSDC Studio AI Implementation Series, a hands-on webinar designed especially for managers and professionals like you with a 100 days AI tool challenge. So we have already lined up amazing speaker for that, and we have today Daryl Bennett. So I'm hoping that I'll see you guys over there too. And it is going to be at 10:30 a.m. CST, 12:30 a.m. SGT, and 10 p.m. IST, 11:30 a.m. EST. If you guys haven't received the registration for AI tools, so I'm sharing that in your chat, in the chat box for your convenience, so that you can register right now and you can join this webinar as well. Just allow me a minute for that. So apart from that, we also have like tomorrow also we are going to conduct one more session on the learning development. So I'm sure I'll be able to see you guys on the same time here as well. Now it's time to celebrate our referral champions. So we have top three performers, Bhanu Durgesh, EBI, and Avinash Kumar. Thank you so much for your referrals, and thank you so much for your initiative to helping us simplify our initiative and reach it to the wider global audience. Congratulations to all three of you for earning the $400 worth gift certification vouchers, and keep the momentum going. You can also be part of the referral championship. So what you have to do, if any of your peer colleagues and professionals wants to join for this webinar or any other webinar which we are conducting right now, you can check all of the webinars on our GSDC website events page. So you can refer them via the registration link, which is also you are going to find in our GSDC event page. So once you will hit a 50 referral point, you will be able to get a free gift certification voucher worth $400. So make sure, guys, you're grabbing this opportunity, because we are having a lot of good opportunities for you for our webinar who are for our participant who take their valuable time to join the webinars with us and to help you in your learning journey. So and if you want to be one of our speaker for learning capsules, webinar, and podcast, you can reach out to us. And these are the website where you can connect with us on our LinkedIn group, on our website, on our WhatsApp group. Also, we would love to hear your feedback, what you think about the sessions we are scheduling for you, and what is the takeaway you are getting from the session and learning outcomes you're getting from the session. So if you could drop your feedback on Trustpilot, that will be very great. Because we would love to help hear your feedback and make your learning journey more dynamic and engaging. And you can help us with by dropping your feedback there over there. So I am sharing all of this, connecting LinkedIn, WhatsApp, and website link all in the chat box for your convenience. I'm also sharing the Trustpilot link as well in the chat box for your convenience. Make sure you're dropping your feedback over there. And with that, it's time to come to an event. Thank you so much, all the participants, for joining for this webinar. And thank you so much once again for Dr. Ibrahim for coming on our platform once again and giving us a very amazing, insightful session. And have a good day, good night, good evening, wherever you are. Keep learning, keep energizing, and keep showing up in our webinar for your learning journey. Thank you so much, everyone.
Thank you so much.